Yeah, so semen volume is variable depending on the biggest one is how long has it been since you last ejaculated, right? So the longer you delay between one ejaculation to the other, the more semen volume you will get. That's probably the most predictive. Hydration can play a role. So if you hydrate more, certainly you may see more semen volume. Sometimes it's a low semen volume because you're actually having less force of ejaculation. So interestingly, when you're young, the force of ejaculate can be really, really strong. It can be up to 30 to 60 centimeters away. Like when you ejaculate, that's how forceful it can be. As you age, after about 50, it can decline to 15 to 30 centimeters away. And so that can feel like you're having less volume because it's less forceful. And so in those cases, that's because of the pelvic floor muscles that are around the urethra, those muscles there that help sort of propel the ejaculate out. And so you can strengthen those muscles with, again, pelvic floor exercises like Kegel exercises. I caution people because people are always like, oh, these Kegel exercises are great. They're going to increase orgasm. They're going to make my semen propel further. And I think that's fine if you're not having pain, you're not having discomfort, and you're doing them correctly. Because sometimes what we see is it can actually cause harm if your pelvic floor is tense, like we talked about earlier, or it can cause pain and dysfunction if you're tensing, and not relaxing. And so if you don't know how to do them correctly, then you could actually harm yourself. But yes, they can improve semen volume by the parameter of increasing the force of ejaculate and getting more ejaculate out that may be left over if you're not having as forceful of a muscular contraction.